Sometimes we have patients call into the office and they say, "Help, I'm obstructing right now. What can I do?" They could be either in the ER, in the hospital, or at home just wondering, is there anything I could do to help with this obstruction? So we're going to go over some tips and tricks, and I will actually show you a technique towards the end of this video. So watch the whole thing. One of the things you could do if you are obstructing, and if you're in the hospital, sometimes doctors want to put an NG or a nasal gastric tube down your nose and into your stomach to help relieve the pressure as you are obstructing. You can ask the doctor if it would be appropriate to use a juvenile NG tube. And what a juvenile NG tube would do is be a little bit more comfortable in the process. Unfortunately, NG tubes are just not very comfortable, and I know every single one of our patients say if I could avoid ever having an NG tube again, that's what they would like to do. But if you're in that position and you need an NG tube, talk to your physician and see if that's something that would benefit you. Something else that might help is a medication called Levocin SL. The SL stands for sublingual, and Levocin helps decrease gut spasms. So when you're obstructing, your gut is also spasming, trying to push food past that obstruction or that narrowing in your stomach. So Levocin SL may help. Ask your doctor, see if that is something they feel would help with the cramping, the pain, and just relaxing the gut. Whether you are at home or in the ER, alternating hot and cold might help. A warm hot pack and a bag of ice, 20 minutes on, 20 minutes off. It just might help with the spasms and help calm the gut down. So that is also something you can try. Another thing that works is walking. Walking helps trunk rotation, helps move gut contents. Walking or getting on all fours and doing a cat-cow, or making a figure 8 with your bottom as you're on all fours. Just something that's going to add some rotation, add some movement to that gut to hopefully change positions of the intestines and of the gut content. Next, I'm going to actually show you a technique for obstructions. It's called compressions. Do not do this technique unless you've talked to your doctor. I personally have not seen you. I personally do not know why you are obstructing. If your obstruction is adhesion related, this technique will work wonderfully. But you must ask your doctor if this is something they feel would help. What I'm going to show you is called compressions. It must be done on skin. I am making this video and I do not want my tummy all over the world, my bare tummy. So I'm going to show it to you over my scrub top, but you must do this technique on skin. What this technique is, it's compressing. So your gut is in spasm as we have a bowel obstruction, and the compressions will help decrease the spasms. And it will also, you're obstructing, so in your intestines there's a kink because of an adhesion. When we do the compressions, what you're going to see is it changes the shape of the intestines, and so hopefully between decreasing the spasm and changing the shape of the intestines, food is going to move through. Compressions are really simple. Remember, do it on skin and make sure you have your doctor's permission. You're going to come in from the side, completely on skin, and you're going to take your palms of your hand. You're going to put it into your side of your stomach, just below your rib cage. And you're going to compress the two edges of your palms together. And then I'm going to relax my fingers around the rest of my gut. But the compressions are happening between my hands. So I'm compressing. You see how my heels of my hands are coming together? And then I'm going to relax my fingers. I can actually feel this in my back. Some people like to lean forward. Some people like to lean back. Some people like to do it laying in bed and putting pillows underneath their elbows. It doesn't matter, but we're going to compress. For how long? Oh, 2 to 5 minutes. 5 minutes is a long time, but we want to calm that gut spasm down. After 5 minutes, I'm going to slowly relax. If I go fast, that's called a recoil or a rebound, and it just actually puts the gut into spasm. So just slowly come out. Take a nice big breath. Do it again. Heels of my hands, come on in. And compress. And then we're going to relax. When the obstruction has passed, the adhesions are still present and still able to wreak havoc and cause another obstruction. You can have adhesions from any type of inflammatory process. The most common cause is surgery, such as bowel resections or an abdominal surgery as an appendectomy or gastric bypass. Even C-sections and hysterectomies can cause adhesions. Other causes of adhesions could be radiation damage, inflammatory bowel disease such as Crohn's, or even infections. After you have stopped your current bowel obstruction, you must address these adhesions. Surgery? Sure, but surgeries can cause more adhesions and more issues. Consider clear passage. If you decide not to use surgery for your adhesions, consider clear passage. Clear passage is an all-natural, totally hands-on manual therapy that decreases or eliminates adhesions. In studies, clear passage, or the Warren technique, has been shown to decrease readmissions to the hospital for small bowel obstructions by 15 times the norm. That's a phenomenal statistic. So if you don't want to have surgery and create more scar tissue, consider addressing your scar tissue by coming to an all-natural, all hands-on manual therapy. Give us a call today.